Beware, source of the information provided in the video is purely based on information available online. Take any remedies or treatment at your own risk. These are generic video just to provide you basic general knowledge. Content and advice or anything shown in this video is not verified or provided by any expert. We do not take any responsibility whatsoever. Urinary tract infections (UTIs) are typical. Approximately 1 in 2 girls and 1 at 20 guys will get you, and to get a whole lot of girls, it is a recurring matter. Most people are knowledgeable about the symptoms: burning feeling when passing urine, frequent illness, a muddy, bloody or quite smelly pee, and general distress in the region. High fever, back pain and nausea happen when the disease grows more severe and goes into the uterus. If it happens, it's essential to see your GP, as left untreated that an illness may result in kidney damage. A urinary tract infection can vary from a disease of the bladder into a disease of the kidney. Cystitis, a disease in the gut, is actually the most frequent UTI. Why do infections occur in the first place? Bacteria do not typically reside in the urinary tract, so it's a sterile place. However, they could enter into the urinary tract and multiply, causing an illness. This may happen during sex or stripping back to front after menopause for girls. The urethra is quite straight and short, which makes it much easier for germs to maneuver in the bladder. Changes into the immune system can earn an individual generally prone to diseases, in addition to fluctuations in hormonal levels. Diseases are more common only prior to a time, and also in pregnancy. As women age, cells of the lungs and bladder become drier and thinner with age, in addition to after menopause or a hysterectomy, causing a larger prospect of disease. Identification is straightforward. A urine test arranged by a GP may determine the reason for disease, and therapy is generally a class of antibiotics. But recurrent illnesses are common, and various studies have revealed that girls are in a 20% to 30% higher chance of having a recurrence of disease over a few weeks of a first UTI. As stated by Kidney Health Australia, girls are somewhat more vulnerable to recurrent urinary tract infections should they utilize spermicide jelly or a diaphragm for contraception, have experienced a new sexual partner, suffer with melancholy, experienced their initial urinary tract infection before or at 15 decades old, have a history of recurrent urinary tract diseases. We are aware that overuse of antibiotics can result in a disturbance in bowel flora health, causing a higher susceptibility to infections. Gut flora constitutes 2/3 of the immune system. This is really where herbal remedies may be helpful. Herbalists have used the subsequent 7 herbs. Bearberry, also called uva ursi. In a double-blind placebo study of 57 women with recurrent UTIs, bearberry has been demonstrated to efficiently suppress additional disease. Bearberry functions as an antibacterial, urinary antiseptic and effluent into the mucous membranes of the urinary tract. It's also a diuretic. Dandelion foliage. Distinct to the origin that has a focus on controlling liver and digestive wellness, this herb is more powerful diuretic used to nourish out the bladder and alleviate symptoms. Cornstalk has calming, mucilaginous or even demulcent properties. This soothes the mucous membranes. Additionally, it has a stimulant effect, full of silica and other minerals that help strengthen the cells. Horsetail acts in an identical manner to silk. Marshmallow origin. Yes, first marshmallow candies was created in this plant. Since you might imagine, marshmallow includes a softening demulcent impact on mucous membranes of the urinary tract. Cranberry. Technically not an herb but employed by herbalists. Flordisa Natural Health Professional has conducted extensive research on cognitive extract. Cranberry helps stop potentially dangerous bacteria from adhering with urinary tract walls, also efficiently flushes the bacteria in the urinary tract to help promote urinary tract health. By helping maintain a fresh urinary tract, this will cut the frequency of recurrent cystitis. Golden seal is a powerful antiseptic and mucous membrane that's suggested for inflammation of the urinary tract walls.